right, Kara. Anybody knows a cancer diagnosis is certainly a life-changing and difficult event.
Patients are in need of both support mentally and physically. And now there is a place where patients can get just that, someone to hold their hand through the entire journey. Take a look.
I had 4 rounds of chemo, then I had a month off, then I had surgery, month off, another 4 rounds of chemo, about a month off, then 45 radiation treatments.
It's been a long, hard journey for Chris Prue. She's a breast cancer survivor who came to Windham Hospital and turned to the Cancer Navigation Program for help.
Patient Navigation is a program to provide services to people diagnosed with cancer to help them work through the barriers that they might encounter when they're diagnosed and in treatment.
Kate Starkey is the Oncology Program Manager here at Windham Hospital. She says this Cancer Navigation Program is essential in helping patients. It connects them with physicians, different cancer programs, and support groups.
I needed somebody to talk to. I mean, I don't care. My family was great, the whole bit. My husband, my 3 daughters, my family on the West Coast, they were all there for me. But I needed to talk to somebody that knew more.
That's where Kate came into the picture.
I felt like she was like a sister, and I could call her anytime just to ask the silliest of question, because I wasn't feeling good that day. Is this okay? You know, and that's the biggest thing, is that, yeah, what you're feeling is normal.
She began attending meetings and support groups. Kate also put her in touch with Look Good, Feel Better, an American Cancer Society program. It provides monthly meetings with licensed cosmetologists.
That teaches them, what makeup is right for their skin type and how to apply it, and when they lose their eyebrows, how to apply makeup so that they look like they have eyebrows, and just different things, how to wear headpieces. And so sometimes it's just teaching them how to tie a scarf around their head. It's a really great service.
You're in a group with a bunch of other women with different types of cancers. Everybody's flipping off their wigs. You're sitting in there bald-headed. You're all talking. You're trying on different wigs. You're trying on different hats. You're having fun.
I think one of the hardest things for women going through this is losing their hair.
Yeah.
And the fact that you can think back on that day when you all took your wigs off and you can smile is amazing.
You're laughing. It's just a bunch of girls playing with makeup.
There are many other resources available through this program, like this journey book given to all patients.
Just helps them keep track of, phone numbers, physician questions, lab reports.
Because there's so much.
There's
that you have
so
to keep
much,
track of.
and it's even if you're savvy and you're really good with that stuff, it's still overwhelming. And then this is a post-mastectomy kit.
It contains this little pillow to use under their incision, as well as tons of literature filled with information.
They call these prayer shawls,
Oh.
and then they're given to all cancer patients.
Oh, wow.
And it's just that somebody was basically praying as they were crocheting or knitting it, and they gave it.
3 years after her journey began, Chris is going back for reconstructive surgery. She says that Kate was the first person she reached out to for support.
And this is what's so good about this program, that you have them long after you're completed with your treatment.
This program has come a long way, and it's about to get even better.
A few years ago, we started navigating breast cancer patients. And last fall, we received a grant through the Jeffrey P. Austin Family Foundation to expand our navigation program and include all cancers.
The grant will help expand the program through the hiring of a nurse navigator. This way, clinical and non-clinical navigation will be available to patients.
What would you say to somebody who was just diagnosed and are maybe nervous or scared about the journey ahead of them?
But we would want them to know that there are resources available. Remind them that whenever they need something, we're here and we're just a phone call away.
I learned one thing, and I'm a strong person, you need help, and don't be afraid to ask it. These resources are here. Use them.
So there's hope and there's help.
There's absolutely hope. More and more people survive cancer every day, so there is hope and help all the time.
That's what a great program. And to learn more about the Cancer Navigation Program, you can head right to our website, WFSB.com.
When we come back, we're opening up the mailbag. See what you got to say. That's next.